Day is almost Misinformation Helpline, how can I help you?
Hey, so I'm wondering if you can explain orofacial myofunctional therapy to me. I see it everywhere, but I just don't get it. Is this legit?
Great question. So let's start by defining an orofacial myofunctional disorder. OMDs are patterns that include orofacial musculature and interfere with normal growth, development, or function of orofacial structures or call attention to themselves. They can sometimes co-occur with speech or swallowing disorders. Signs and symptoms may include oral mouth rest posture, structural abnormalities like an open bite or tongue tie, abnormal tongue rest posture, distorted productions of s and z, as well as trouble producing some lingual sounds. This may also include drooling and poor oral control for children over 2 years old, extended non-nutritive sucking habits, and tongue thrust swallow past the age of elimination.
Okay, got it.
Now let's define orofacial myofunctional therapy. The primary purpose of orofacial myofunctional therapy is to create an environment in which normal processes of orofacial and dental growth and development can take place and be maintained. According to the American Speech Language Hearing Association, this includes 6 main things: establishing nasal patency, improving speech sounds, eliminating non-nutritive sucking habits, modifying handling of liquids and solids, oral rest posture, and labial, lingual, pharyngeal resistance exercises.
So what does that mean?
Establishing a patent nasal airway means figuring out why a client has trouble breathing through their nose. Majority of mouth breathing is due to enlarged tonsils or allergic rhinitis, so oftentimes a referral to an ENT or an allergist is warranted. And sometimes orthodontic treatment may be used for palatal expansion. To improve speech sound production, evidence-based speech sound disorder interventions should be utilized. And this does not include non-speech oral motor exercises. Prolonged sucking of pacifiers and digits over 3 years old is associated with increased risk of malocclusion. Now, there's a lot more nuance here, but elimination of the sucking habit can help by supporting closure of the open bite, which may or may not have any speech or feeding implications. Modifying handling and swallowing of liquids and solids may be required for some clients with OMDs. This should include oral motor and pharyngeal interventions that are based on motor learning and neuroplasticity principles. A very frequent goal of OMT is to establish oral resting posture. That includes lips closed and breathing through the nose. Sometimes open mouth posture can continue even after nasal patency has been achieved, so some clients may need reminders to close their lips and breathe through their nose. Other functional outcomes of working on this are unclear. And then there's the labial, lingual, pharyngeal resistance exercises. So these exercises are supposedly used to teach closed mouth posture and nasal breathing, but a lot of them are just repackaged ensomes without any functional transference to speech, swallowing, or feeding skills.
So what I'm gathering is that there really isn't anything special about OMT as compared to what we should be doing as speech language pathologists anyway. Making appropriate referrals, counseling on development, and improving speech or feeding skills based on our individual clients' needs.
Correct. And just because you hear something is frequently used in OMT doesn't necessarily mean that it's supported by research.
Then what's all the hype about?
Well, there's a lot of talk around specific exercises or products that are used in these practices that require you to go through really expensive courses to learn about. However, as I said, majority of these are just repackaged ensomes with really good marketing.
Yeah, I've definitely seen some of those courses and products.
Hard not to fall into it when you see it frequently and dark marketing strategies are used to make you more susceptible to believe it.
So maybe I don't need to take a $3,000 course on the topic?
Honestly, I'd save your money.
Got it. Thanks so much.
Of course. Call back anytime. Bye-bye.